Good day, everyone. Uh, my name is Yahaya bin Hassan. My presentation will be on design consideration for COVID-19 patients hospitals. Basically, as far as the latest figure of infected COVID patient in Malaysia is about 17,000 now, which is way past when we first started. It was about only 2,000 cases. And actually, the cases can easily be divided into 5 categories. Category 1 and 2 does not really need massive treatment, but for 4 and 5, most of the patients have to be put in ICUs. And with that number of patients, generally in Malaysia, we are running out of ICU bed. So quickly, I will just jump through what are the hospital design abilities to perform as pandemic hospital. As what happened now, most of the hospital in Malaysia has undergone tremendous renovation or changes to categorize into the COVID patients and non-COVID patients. And therefore, in a hospital that need to perform as a pandemic hospital, it has to be firstly flexible, where it can reconfigure itself to separate the patient's flow, the staff flows, equipment and consumable items. Secondly, the ICU has to be enhanced. Some area has to be converted into ICU to care for the surge in critical ill patient, basically for category 4 and 5. A lot of SOP documents, standard operating procedures document, have also been listed by the Ministry of Health and working together with WHOs. And I think in future, or even now, this SOP has to be translated into design requirement for future hospitals buildings. The other abilities that the hospital need to have is the ability to convert the aircon system, ACMV system, from positive into negative pressure, where for room that has to be housed which we need to house the COVID patients have to be designed as negative pressures. And more so we also have to look at the consideration of having switches which are touch free, especially for lighting or motion sensors. And the other part of the building construction hospital is they now have to look at building material which can eliminate microbes or virus, especially on the painting, on the floorings, on the ceilings. And okay, we also we have to look at the connectivity system with the patients, especially most of these patients when they are being warded or put into the ICUs, they are basically not allowed to see any visitors or loved one. So the connectivity system has to be there to share either with the patients and their loved one, or the staff with their families, or the visitors that comes in that need to operate in that areas. And lastly, I think we have to look at the comforts of these patients with the crowd that they have. It will be less comfortable, and then with the non-allowable of friends and visitors, basically they feel very lonely. So we have to make it as comfortable as possible. And the next one is after looking at the hospital as a building, then we also have to look at the requirement of the patients. How do we maximize the patient experience in such a pandemic hospital? We have to look at the flexibility, the usage. That means some of these areas have to serve for multiple function. It could be in the ward room, it could be in the public areas, it could be in the waiting areas. And also we have to look at the requirement of the design, the mechanical system. It has to be robust so that it can meet the requirement of the patient's needs when they are COVID patients or when they are not non-COVID patients. So there are two different needs. So basically, again, we have to look at the usage of technologies here to enhance the patient experience. Either they have to be fully informed of what's happening to the outside world. They have to feel that they're still part of the world rather than facing the loneliness in the wards. And the infrastructures in the hospital also has to be able to meet those patients' such a requirement. Next, we go into the innovative technologies, as I mentioned, that we have to put in the telehealth service where there will be less context between the service providers and patients. And we also have to put in with these technologies, enhance the virtual care or the telecommunication that can provide a safe care environment and still maintaining the patient privacy. Next, we have to look at the innovation process where we place into the patients, we empower the patient to have to check in anytime that they want, they self-check in themselves. And if, while doing that, it is also designed such that the physical distancings are being there all the time. And of course, if it is now become essential to have a drive-through process where testing and vaccination can be done inside their vehicles. The touch technologies, I think this is also to reduce contacts. So motion sensors, touch surface that are not required touching at all, or automatic door, and sort of like motion sensor faucet. All this can help to maximize or improve the patient's experience and also the safety in terms of infections. Material selection must be selected based on mitigate infection, and it must be easily maintained and clean. And lastly, the contingency plan must be there, that it must design for healing purpose, healing environments, and it can help also to support the changes in behavior among the patients while maintaining the safety protocol, continuity of care, and the space requirement. These are some of the basic layout during COVID-19 pandemics. We're looking basically at working area of the healthcare workers and surrounded by the mild and moderate case. I said basically these are class category 1 and 2, while the severe case 3, 4, and 4 will be at the severe case, and at the critical case are mostly cases, category 5 cases. Again, on the layout, we want to shoot the standard hospital layout for pandemic situation, where we need to have the staff area and surrounded, it has to be where the patient comes in, triage can be done. And then it house all the mild and moderate cases. As the cases get worse, then we move to the severe cases and critical cases. Next, we have to look at how does the safety of the staff and efficiency of the staff can be met even with such a building. So we are looking at 6 areas of concern, which is the administrative office that need to be, the density has to be increased. Currently, most of these areas are very small. Patient room have to be designed such that to prevent the spread of virus into the service provider. The emergency department, we have to look at the screening process has to be made such that people with COVID patient symptom must be stopped at that point of and treated in another an area which is earmarked for COVID patients. Pharmacy as well, we have to ensure that the drug shortages are not there. So there must be a direct communication system between the doctors and the pharmacists. The aircon system has to be robust enough that it can allow areas of where treatment has to be done, we can convert it into a positive pressure. And lastly, telehealth. This is also because if the telehealth is being installed, most of the patient provider can reduce the contact with the patients. This the next slide show the service layout, which is about similar as I mentioned before. The only difference is that now there are staff changing room, patient entry room where they are being triage are being done, and after they go through the areas of short stay, severe case, and critical case, There are also zones for where all the PEP and zone clinical waste are being put in, and there are body holding areas when there are deaths. And look, again, we are not forgetting about hospital which runs as a business. These are some of the area of concern where for future, when the needs of diagnostic testing and treatment, which we have to be installed, which can reduce length of stay and improve the performance of such hospital. But as we know, during COVID, all the private hospitals suffer tremendously in terms of loss of revenue and profits. Okay, next one, we also have to look what happened after the post-pandemic. The ICU has to be downgraded and utilized for either transition bed, surgical bed, or daycare. And we also have to look at the specific limitation of the area that the hospital have designed. Number 4, we have to look at the possibility of converting some of this area during pandemic, that we can install isolation area through using container, using modular integrated construction. And also number 5, that if we can use a lightweight steel modular building which can easily be recommissioned or be dismantled after the post-pandemic. And lastly, to create a flexibility in the design to expand areas that can be easily convert or utilized without changing so much, and still meeting the standards of the requirement, clinical standard. And lastly, on the conclusions, there are about 9. I do not want to dwell so much because there's not much time. So firstly, to improve infection precaution, we have to make sure there's not much infection in the hospital. Increase the isolation room capacity when during pandemic, when the need for isolation room. Triaging a patient at the point of entry is also critical, and it has to be made into a process which is comfortable to the patients. Diagnostic imaging waiting area has to comply to all the SOP requirement during pandemic. Example like physical separation between people. And number 5, planning for in-person search capacity in terms not only of an aspect of the facility, but the aspect of the human resource, the staffing, the supplies, the equipment, the logistics, and the expertise that run the critical areas. Not forgetting that design of the search capacity for both outpatient and inpatient has to be there, and it has to be flexible enough for the hospital to convert into the required ICUs. Designed to cater for proper storage area, and huge supplies of PPE and disposable item has to be there. And to reduce contact between patients and possible provider, usage of telemedicine has to be installed. And lastly, the operating room in the hospital need to function more effectively, efficiently, and safely. With that, I conclude my presentation.